Hi, I am Dr. Navodaya Gilla, consultant physician in Care Hospital Banjara Hills. I am here to speak about few things about asthma. Asthma is an allergic response of the respiratory bronchioles and uh, bronchi, which causes narrowing due to the excessive release by the eosinophils or IgE. So, it's a response or allergic response to some trigger, which are usually in the form of dust or some viral particles or bacterial infections. So, if a person needs to avoid, or if a person who is already an asthmatic or has the predisposition to get an asthmatic attacks, he needs to avoid these three the triggers like dust or viruses. So what happens if there is a trigger and a person who has asthma have the symptoms? Usually the common symptoms are because of the infection or the dust, but the symptoms for because of asthma is difficulty to breathe and wheezing. Wheezing is a musical sound because of the air entering through a narrowed passage, or exhaling, that is air coming out through a narrow passage. So, because of which the patient has difficulty to breathe, chest tightness. So, and what are the other symptoms? Other symptoms are irrelevant to the infection or the triggers, and what to do or what to not to do. So, what to do if a patient who is asthmatic predisposing or asthmatic trigger has triggered the asthma? It is better to meet a doctor, get the examination done, and he will be prescribed based upon the severity either medications in the tablets or inhalers or admission into the hospital for giving IV injections. What medications we usually see for treating asthma is antihistaminics, steroids, antibiotics, and nebulizers or inhalers. So these are the common things which we usually prescribe with along with the monitoring of saturation. If oxygen percentage is low, we give even oxygen. And who needs the admission? If the trigger is so severe that patient is not able to breathe, having severe breathlessness, saturation low, he needs to be admitted, given treatment in the form of IV. So, what are the complications that we are going to face? The asthmatic triggers can sometimes be so severe that the patient may need to be intubated or put on ventilator for the betterment of his health. So, this is the direct complications of asthma. So, the people who are asthmatic or predisposing to get asthmatic attacks, it is better to be in a warmer areas or warmer places, avoid cold beverages, and do breathing exercise. Good nutritious diet will help the immunity to be in a better state to avoid the triggers or fight the infections very fast and avoid the complications of asthma.